you.
Awesome. Thank you, Dr. Miller. We will now move on to our next session. I would like to introduce our fourth presenter for today's symposium, sponsored by Advent Health and SK Life Sciences, Dr. Nancy Rodgers-Neame. He'll be discussing the topic, how important is quality of life in epilepsy? Dr. Rodgers-Neame is originally from North Carolina. She's made Florida her home now, and she is the medical director for Florida's Comprehensive Epilepsy and Seizure Disorder Center. She is also a diplomat of the American Board of Psychiatry and Neurology, board certified ABPN, and she has a specialization in epilepsy. She has extensive training and experience in the treatment of epilepsy and seizure disorders. Welcome, Dr. Nancy Rodgers-Neame.
Hi, so sorry that my camera isn't working today, but the important thing is that you can see the slides and hear me, so we've got the important part down. The title of my talk today is How Important is Quality of Life in Epilepsy? And what I hope that you're going to get by the end of this is that the quality of life is really the most important thing in epilepsy. Next slide. So what does quality of life in epilepsy mean? It means that seizures are controlled to the best that they can be controlled, hopefully seizure-free, that the person not have any medication side effects, particularly long-term side effects, and we'll get to that later, that comorbid conditions are addressed by your epilepsy specialist, that you have a normal social life, a normal work life, and a normal home life. So these goals may not always be achieved, but this is what we are working towards. Next slide. But how do we do that? Next slide. Living well with epilepsy, first you need to know your options. Medications, there are many more than just 3 or 4 medications. A lot of people think they've been tried on everything because they've been on 3 or 4 medications, either individually or together. Lifestyle changes, the patient needs to know what kind of things that they can bring to the table in terms of improving their lifestyle, including healthy choices, as in things that you eat and what kind of exercise that you get plenty of sleep, that you manage stress, that there has been at least consideration for surgery. There are new techniques and improved outcomes. So even though you may hear from somebody, oh, I had epilepsy surgery 20 years ago and it didn't do any good, that doesn't mean that you wouldn't respond well to a new technique. Managing comorbidities, as we've already heard from several speakers, is really important, including depression, anxiety, insomnia. Insomnia and anxiety can also make your seizures worse. The postictal state, if you have problems with your postictal state, either psychiatric problems or energy problems, those things need to be addressed. Headaches are often a big comorbidity with epilepsy, not just as a comorbidity of the epilepsy itself, but sometimes side effects of the medications. And finally, education. So it's important that your family, friends, and coworkers that are likely to be exposed to your seizures or see your seizures, that they know what your epilepsy is and how to address your seizure should it occur. Next slide. So this may come as a surprise to a lot of people that there are at least 26 different kinds of epilepsy medications. And just because you've been on 1 or 2 of the medications doesn't mean that there isn't another choice for you. Side effects, not every patient has every side effect, even the common harmless ones. The long-lasting side effects that you should expect from your epilepsy medication are none. A lot of times patients will come into my office and say, well, if we're going to try this new medication, what kind of side effects should I expect? And I tell them, in terms of long-term treatment, you should expect no side effects. Most epilepsy medications have less potential side effects or even serious adverse events than any known antibiotic. And I can't emphasize this too much, because a lot of times people say, oh, this epilepsy medication has a black box warning, or that a couple of people have developed this serious adverse event, and it's important to put this into perspective and look at potential side effects from antibiotics. So many of the antibiotics cause allergic reactions. They cause unpleasant side effects that are there for the duration of the medication. But the difference between epilepsy medications and an antibiotic is that there's light at the end of the tunnel for most antibiotics, because you take that for 7, 10, 14 days, whereas epilepsy medications are going to be with you maybe even for your entire lifetime. So that it's important that you not have ongoing side effects from that medication. Next slide. So this is just getting a little deeper into what I said before. All medications that work have potential side effects, even serious ones, and that even includes things like that you get over the counter or natural remedies. They all have potential side effects, even serious side effects, and including life-threatening side effects. And so that's something important to remember when you're considering any kind of treatment. Most of the side effects, thankfully, are transient or short-lasting, or can be managed with careful medication adjustments. So sometimes when people have side effects, we can decrease their medication, slow their titration schedule down, or adjust their medications so that they take them at a time of day that they don't have the side effects. Most medication side effects are benign. In other words, they don't cause serious or long-lasting problems. And that's important to remember if you do experience a side effect from a medication. Every rash is not necessarily an allergy, so it's important for your doctor to see your rash if you think that you've gotten a rash from a seizure medication. And every symptom that's experienced is not a side effect. Next slide. So lifestyle choices are really important in quality of life in epilepsy as well. So you need to get plenty of exercise. And can we go back to the previous slide? You need to get plenty of exercise and have a active social life. I know it's very hard to do right now with the pandemic going on, but make sure that you talk to your friends and family. Next slide. Get plenty of sleep. I can't overemphasize how important it is to get plenty of sleep, especially if you have epilepsy. Some people's epilepsy is much more sensitive to lack of sleep than other types of epilepsy, and so, but for everybody, brain health depends on getting plenty of sleep. Next slide. manage stress. So a lot of times that is not the easy, it's easy to say, but not always easy to do. There are plenty of things that you can do to help manage stress. Some people like to do breathing exercises. Some people like to do physical exercise or take a walk or change your environment. Those things are very important to quality of life. Next slide. So what about treatment of epilepsy? Every patient should be considered for epilepsy surgery, either for palliative purposes or to actually cure the patient's epilepsy. Most surgery is not what it used to be. It's more directed to the origin of the seizures. It avoids taking out or removing healthy tissue. There's less scarring, both on the person's head and in the brain. And another thing to keep in mind that we've already been over in more detail is that neurostimulation may also be an option. Next slide. So to look at the different types of surgeries, including the old style of anterior temporal lobectomy, where the anterior tip of the temporal lobe is removed and there's a large question mark shaped scar, and potentially that healthy tissue is being removed as well. So that has transformed into a procedure called amygdala hippocampectomy, where only the amygdala and the hippocampus are removed. There's a much smaller scar, almost unnoticeable after it heals, and much fewer problems in terms of loss of memory and cognitive problems post-surgery. Next slide. One of the things that people ask me all the time is, where are my seizures coming from? Why am I having seizures, and how do I see where they're coming from? And so one of the options for doing this is getting dense array EEG for localization. And here's a picture of a child with a dense array EEG in place. And what that does is gets a more comprehensive view of what each part of the brain is doing, and so covers more of the brain tissue than a standard EEG. Next slide. So this is the kind of data that we get out of that, and you can see that where the raw data looks like just a bunch of squiggly lines, but it can be, the seizure focus can be projected onto a MRI. And if you look in the lower right-hand corner, you can see where the seizure focus is on the MRI and see how accurate this actually is. If you look at the circle up there, what we sometimes call a Pepsi map, shows where the seizures are located on the head in a more graphical format. Next slide. And here's an up-close view of the seizure focus. And it helps patients as well as the surgeons to know exactly where the seizures are coming from. And this shows a map of where the seizure focus is. Next slide. This is just showing a graphical representation of responsive neurostimulation and placement of responsive neurostimulator probes can be more accurate by determining exactly where the seizures are coming from. Next slide. And this is a X-ray on the right and a graphical image on the left of responsive neurostimulation. Next slide. So one of the most important things that I have my patients do, and I think is really important, is to take a list of questions to every visit to your doctor and tell your doctor if you're having side effects, tell your doctor if you're having depression, anxiety, insomnia, if you're having problems postictally, and if you're having headaches. Next slide. Education is make sure that you tell your family, friends, and coworkers about your epilepsy. A lot of people are worried about other people knowing that they have epilepsy, but it's better for them to know in advance and to know that there's a plan in case you have a seizure. And so letting them know what the proper procedures are for seizure first aid so that someone doesn't put a spoon in somebody's mouth, what rescue medications you have available, and make sure you give them authoritative information. Next slide. And further, to emphasize this even further, make sure that you tell your family, friends, and coworkers about your epilepsy. People who really care about you will understand. If you look at authoritative information, you can give them good information, and epilepsyfl.com is a great place to start. And also let them know about your rescue medications, where to find them, and how to administer them. We have some really good new medications for rescue, including intranasally, so that they're not all rectal medications. Some are given in the cheek, some are given intranasally, and so those are much more easy to administer to somebody who's having a seizure. Next slide. So quality of life, to summarize everything, quality of life in epilepsy is everything. You need to know your options for your epilepsy, be well informed about medications, which there are many more of now. There's some brand new medications that have different mechanisms of action than previous types of seizure medications. Every patient needs to be considered for surgery that's refractory to 2 or 3 medications. Non-pharmacologic interventions are important, and it's one way that you can feel like you have more control over your seizures. Make sure you talk to your epilepsy doctor about your other issues, especially related to your epilepsy and comorbidities, and recognize and address your problems. Educate yourself and the people around you. Just keep in mind that the goal is seizure-free, side effect-free, and improved quality of life. So quality of life in epilepsy is everything. Thanks.
Thank you, Dr. Rodgers-Neame. And we do have a couple of questions, and one of them related to quality of life, and this is from a parent. They say that they would like to have a good quality of life for their child, but they are afraid to let them explore new things. Do you have any suggestions?
So one of the things that's really important, especially in children, is and it's sometimes hard to do, is to let them explore as many things as they possibly can, but safely at the same time. So some children will have seizures that occur so often and so severely that it really does prevent them from doing things. On the other hand, some parents are really afraid, even if their child's seizures have been very well controlled for a long period of time. They're very afraid to even let them ride a bicycle or go and spend overnight at a friend's house or something like that. And just to keep in mind that a lot of times these things can be done very safely, without worrying about them having a bad outcome to having a seizure, say at a friend's house, as long as things like, as long as they don't stay up too late, or that they don't do crazy things like jumping off the roof of the house into the swimming pool, that kind of thing, which is dangerous anyway.
Yeah.
Or riding a four-wheeler or something like that. That's dangerous anyway, even if you don't have epilepsy. So those kind of things are pretty important.
Thank you. We have another question from another parent who has a child that was diagnosed at 15, and they are now ready and preparing to go to college. The parent is asking for tips on what's the best way to ensure their safety and their well-being while they are away from home.
Well, one thing to keep in mind is that every parent who has a child who's going away to college has concerns about their safety of their children at college. So it's following all these guidelines that improve the quality of life are also important for the child to follow at school. And so knowing what to do and knowing to let the roommates at college know how to address the seizures should they have them. One of the problems that college students tend to have is not getting enough sleep for one reason or another. They sometimes don't get enough sleep because of studying. Sometimes they don't get enough sleep because of socializing. Avoiding drinking a lot of alcohol is another concern about going away to college. And, if your friends know that it's not good for your health to drink alcohol, they will not push it on you. Or people who really are your friends won't push it on you. So that is, and all I can say is every parent worries about their child at college.
This is true. Thank you so much, Dr. Rodgers-Neame.
Sure.
Awesome.